coming?
Yeah.
Like Reagan just got done explaining, I'm going to show you some pictures of what a normal lung looks like and what a blastomycosis lung looks like. A normal lung is, which is to your left. You can see the shape of the lung, it's clear. You can tell, you can see the rib cages. On this one, you can tell that something is just not right about this lung. It's hazy, it just doesn't look like it's supposed to look. The other form of blastomycosis she talked about was the cutaneous blastomycosis, which is manifested with lesions and areas all over the body. Today, I want to talk to you about another form of fungal infection that's called histoplasmosis. Like blastomycosis, this is a fungal infection that's spread through breathing in spores from the fungus Histocapsulatum. This is the most common fungal infection in humans. Histoplasma capsulatum is particularly prevalent within the eastern parts of the United States along the Ohio River Valley. H. capsulatum is found in moist soils containing a high level of nitrogen, such as bat droppings and bird droppings. There are two different strains of this H. capsulatum. There's a var capsulatum, which is widely distributed, and then there's a debosi, which is most limited to the Africa area. The spores of both become airborne and is inhaled within the soil that is disturbed by humans, whether it's the activities or by the wind. There's another form of H. capsulatum, which is a cutaneous form. The inoculation can also lead to this disease, but it's very rare. H. capsulatum is an intracellular parasite, meaning it survives inhalation and phagocytosis. Macrophages disperse the fungus beyond the lungs via the bloodstream. Cell-mediated immunity normally takes care of this within a healthy individual. Rates of manifestation. There's about 95% of individuals infected with pulmonary histoplasmosis are symptomatic. Asymptomatic, which means that they normally, this symptoms resolve on its own without damage. The other 5% develop what we call clinical histoplasmosis, which is manifested as one of the 4 different types of these diseases that I'm going to talk about. The first is chronic pulmonary histoplasmosis. As we can tell, this does not look like a normal healthy lung. We know what a normal healthy lung looks like, and for some reason, the person that has pulmonary histoplasmosis has all these infiltrates in the lung. This is characterized by severe cough, blood-tinged sputum, night sweats, weight loss, and loss of appetite. The other form of histoplasmosis we're going to talk about is systemic histoplasmosis. This can also follow the spread of infection from the lungs. This is normally seen in AIDS patients, and it can be spread rapidly, and it's severe and fatal. The other type I want to talk about is chronic cutaneous histoplasmosis. This is characterized by ulcerative skin lesions and can also follow the infection from the lungs. The other one is ocular histoplasmosis. This is a type 1 hypersensitivity reaction against the histoplasma in the eye. Histoplasmosis is diagnosed based upon the identification of the yeast button in the GMS prepared smears. Samples of these are taken for analysis. Examples of samples that are taken are scraping of the skin, the sputum, the cerebrospinal fluid, and also various tissues. Treatment of this particular disease involves the antibiotic amphotericillin B, which is prescribed in severe cases. And if not resolved, they can also prescribe ketonazole, which can be used to treat the mild type of infections. Robbie will come along and talk about another form of fungal infection that can be treated with both of these antibiotics, which is candidiasis.